Hi, I'm Amber, and welcome to the Lone Star Keto podcast. Today, we have a very special guest with us, Cynthia Thurlow. She is a nurse practitioner, a functional nutritionist, and intermittent fasting expert, and a very, very busy woman. She also has a podcast. Welcome, Cynthia.
Thank you. I've really been looking forward to connecting with you.
I'm so excited. So our topic is going to be empowering women to take back their health. Such an important subject, I feel, and it's not talked about enough. So let's get started. And I'd like to hear a little bit about your background, like your professional background, and also kind of your health background. And I'm curious about why you spent so many days in the hospital. What was going on? I didn't really hear the background of that, so I'm curious.
Yeah, no. So I'm a allopathic Western medicine trained nurse practitioner. My background prior to becoming an NP was in ER medicine. So I'm a bit of an adrenaline junkie. And then I spent 16 years in cardiology as an NP. I'm fascinated by the heart. But when I became a parent, I really started to look very differently at the impact of nutrition on our health and wellness. I have a child who's now 15 who had life-threatening food allergies. And that dove me down a rabbit hole of trying to figure out why this happened. You know, I have always eaten very healthy. He was exclusively breastfed. I mean, I did all the right things, right? And so he had terrible eczema. And I kept, saying to the pediatrician, could it be something I'm eating? And she kept saying, no, he's fine. Just put this topical steroid on it. He'll be fine. Well, when he hit a year, I was like, okay, clearly there's something more to this. And so that's when we found out he had life-threatening food allergies. And then I read a book called The Unhealthy Truth. And I'm not sure if you've ever read Robin O'Brien's book, but for me, it was life-changing in the respect that I was getting validation about how our food impacts not only big ag, the influence of the food industry, the processed food industry, the impact on our health, the rise in autoimmune issues, obesity, et cetera. And so that really shifted my perspective. I continued to work part-time as an NP. I had a second child. And then I started to become a little bit disillusioned with what I was doing. I was still, when I was in the hospital or in clinic, I was doing all the things, writing prescriptions, saving lives, like so many other healthcare providers do. But on the side, I was like, maybe I want to go back into academics and do a PhD. And so I took one class and hated it. And then I dove down a wellness coaching program, which I did, but I didn't love it. And then I read another book called Eat the Yolks. And the woman that wrote that book, I reached out to her and I said, I love everything you have to say. Where did you get your training? And so I then did a functional nutrition program and really landed where I needed to be. And that was the beginning of the end of my traditional allopathic medicine career. And so 1 year later, I woke up one morning and said to my husband, I can't do this anymore. And I'm married to an engineer, finance guy. And he was like, what do you mean you're walking away from a 6-figure job to be an entrepreneur? What? You don't even have a business plan. You don't even know how you're going to make money. And I said, I know I'm going to be successful. And so I left actually 5 years ago, April 1st, left clinical medicine and almost immediately had a specific kind of patient that was coming to see me and, is helping to empower women, from, 35 years old and up, people that were heading into peri-menopause and later menopause, really struggling with health issues. And so I was working with people one-on-one. I was creating group programs, which was all very exciting. And then getting to that 13-day hospitalization. So in 2019, I, for the very first time, was able to take a business trip with my husband. I've never been able to accompany him. He's been all over the world. And so he was going to Hawaii. And my mom had finally retired. And it sounded like a fantastic idea. We're going to go to Hawaii and he's going to work during the day. And I'm going to start writing copy for my second TED Talk. And I had a great time when I was away. I got a good chunk of my talk written out, came home and developed the worst abdominal pain I had ever experienced. And I, of course, assumed I had food poisoning. And then it didn't stop and it got worse. And I remember I called my primary care provider, who's a very good friend. And I told her everything that was happening. And she said, you realize you have to go to the ER, right? And I was like, yeah, I don't really want to, though. And something that oftentimes happens with patients when they're very sick is they get this impending sense of doom. And when I was an ER nurse, and even when I worked in cardiology as an NP, if any patient ever said to me, I think I'm going to die, I took it very seriously. And when I got to the ER, I told my husband, I said, if they don't figure out what's going on with me, I know I'm going to die. I couldn't get comfortable. And when I say I couldn't get comfortable, when you have abdominal pain that bad, I mean, it doesn't matter if you sit, stand, sit upside down, you can't get comfortable. And they didn't take me very seriously in the beginning because my blood pressure is normally a little low and my pulse rate, which is normally low, was still within normal limits. And I wasn't running a fever. And it wasn't until the blood work came back that all of a sudden things started to move really quickly. Like I had been handed off to a physician's assistant. And then all of a sudden I had a surgeon, the head of ER medicine telling me I had a ruptured appendix and I had an inflamed colon, which explained why I was in so much pain. And that I was actually so sick, they feared that if they took me to surgery that night, I would lose my entire length of my colon. And as sick as I was, I kept saying to the surgeon, you can't take my colon. And she said, oh no, you would be fine. And I said, no, I would have a bag for the rest of my life, a colostomy bag. And I said, that is not acceptable. And that is not a way to live. Because if anyone of the listeners have ever seen someone who has had their colon removed, they don't digest food well. I mean, they literally just have like liquid stool that goes into a bag and that's how they live the rest of their lives. And so I had a wonderful team of predominantly female physicians, and they said, we're going to try to do everything we can to save your colon and to, get you out of being septic. And so it was this 13-day hospitalization where I had one complication after another. I got a small bowel obstruction. And really it's the body's way of saying, do not give me any food. We are shutting everything down. So I went from being this tiny 5'3" person, losing 15 pounds, which was a ton of weight for me, to getting to the point where I looked 6 months pregnant because my small bowel had just shut down. And then, 5 days in, I started becoming really depressed because I recognized how sick I was. And I had tubes down my nose and I had drains all over the place and I had a central line in, and then they wanted to give me TPN, which is like a bag of crap. It's a bag of soy products so that you don't die, because I was just losing too much weight. And then I developed more complications. I got a couple abscesses. They had to put drains in. I had to go to a special interventional radiologist who was called in to put drains in. And then I developed a fistula. So this was my 13 days of being incredibly humbled. And I came home and I remember telling my husband that I still wanted to do this talk and I still wanted to, make sure I could be home for my children. And so I think the most pivotal thing about this entire story is the power of our mindset. And for me, all I thought about when I was in the hospital was getting home to my kids and my husband, and that I still wanted to do this talk. And so 27 days after I left the hospital, I stood up on stage with a ruptured appendix because I was still not well enough to do surgery on myself. I did my second talk. And then 10 days later, I had my appendix out. And I've been doing really well since then. But it just goes to show you that mindset is everything. I don't care if you're male or female. The power of our mindset is the most powerful thing we possess. And unfortunately, not enough people realize that. And so I tell my boys all the time, I still can't believe I did that. Like, it's unbelievable to me 2 years later, but it also was like something I'm very proud of because I showed them, I wasn't 100%. I mean, it's painful to even look at that video because I look very emaciated. I don't look healthy at all, but I did it. And it was like, I wanted to make sure my brain was still working. I remember telling them, I was like, my brain still works. This is awesome. I can commit a talk to memory, stand up in front of 500 people, give a talk. And then it was like, the rest of the day was fun. It was just fun, being around all these other speakers, and I had family there. And so that's the story about my 13 days and my background.
Wow. Okay. I was not expecting that. Wow.
Yeah.
That's pretty major. Okay. So when you did the TED Talk, okay, it's your mindset is what got you there, but why was that so important? Was it to prove that you could, or was it because what you felt you had to say was so important to get out there?
I think it was more the latter than the former. But if I think about my mindset back then, I think this is really valuable information. And I'm so tired of writing prescriptions. I'm so tired of the pill being an answer to all of my patients' problems. And we've conditioned people to believe that. But I also think it was the fact that when I was in the hospital, when I feel like God gave me a choice, this spiritual intervention that occurred when I was in that hospital bed, I made a decision to live. And I was like, I fear nothing. Like, that is that is what I think is so powerful, is that I told my husband the other day, I was like, I fear nothing. Like, I literally fear nothing. Like, after being that sick, coming back, and, 2020 didn't do us any favors. The way that I live, the way that I encourage my children to live their lives, the way that I live my life is leap. Like, just do it. Stop making excuses. Just do it.
I love, love, love that. And that is something I've had to struggle to learn to do. And I still have some work to do, but the fact that I'm in front of the camera instead of hiding or behind the camera is huge leap for me. So I'm making little steps. So
That's
I think that
awesome.
is amazing, amazing. Kudos to you.
Thank you.
Okay, so I want to get into women in healthcare.
Mhm.
I know that, like, a lot of women, especially the older generation, even like my generation, I'm not going to call myself old, but
Nope.
we're, doctors and health professionals are kind of looked at like they are almost like gods in a way. And you
Mhm.
don't question, you accept, you whatever, and you just do what they tell you, bam, bam, bam. Okay, I
Mhm.
was different because I'm stubborn, and I just had this, I don't know, fear. I don't know if it was fear or just mistrust of health professionals. I'm not really sure why. I think something happened when I was younger, but whatever. I had that. So I spoke up, and if I didn't like something, I got up and walked out. That's just the way I was. But many people don't do that, and
Mhm.
they just accept it. My mother, for one. And why do you think that is? What are some issues with women in healthcare?
Well, I think that it stems largely from the lack of empowerment in many ways. We have to be our own best advocates. And, when I was in clinical practice as an NP, in a traditional setting, there were certain generations, like the World War II generation were my favorite group of patients, favorite by far. And they oftentimes didn't ask a lot of questions, and there was this true intrinsic trust that went on. And I used to say all the time, like, I want you to ask questions. I want you to have me explain to you why I think this is the best next step, whether it's a medication, a procedure, or surgery. And then, I think about my mother and father's generation. They were born in the 40s, so the baby boomers. And it's a mixed bag. Like, some people would ask questions and others would not. They lived through the women's, lib movement. And then you have a whole group of people that I think just kind of coexist. I mean, most of us that were born 60s, 70s, 80s, it's really a mixed bag. I mean, some people have been conditioned to believe that a pill is going to fix everything. And we have largely conditioned our patient population to believe that. I mean, look at all the commercials that you see on TV. I don't watch TV, so I don't see them, but I'm told that there are a lot of commercials on TV.
There are.
Which is annoying. And so we've marketed to our patient population that a pill is going to solve a symptom, instead of really digging deeper and asking people to really do the hard work, because the hard work is the lifestyle changes. And, I believe in most instances, women do the bulk of the housework, and women do the bulk of the child rearing, and women do the bulk of the errands and the cooking and the cleaning. Even if you have help, we are still doing all the things. And so I think it's a combination of lack of empowerment. I believe it's a combination of, kind of traditional roles. And let's be clear, there's no one out there right now that's doing everything themselves. I think most people are having some degree of help, if it's from a spouse, or there's a babysitter, or there's a caretaker, there's someone that's providing some degree of support, family or otherwise. I think that's definitely part of it. And then the other issue that I really see as problematic is this degree of ageism, especially with social media, that and I was listening to an interview. It was Oprah's podcast. She was interviewing Sharon Stone, and Sharon Stone nailed it on the head. She said, women are conditioned to believe that after 40, they are worthless. She's like, that happens in Hollywood, that happens on social media. And I would agree that I knew a lot about women through my training up until, it was kind of like menopause and you fall off a cliff. Like, you don't really hear a lot. No one teaches you about peri-menopause. I mean, good Lord, that 5-7 years preceding menopause, and certainly not menopause. Like, after menopause, you're like an old fart and you have a dried up vagina and you get hot flashes and you're going to get fat and just all these horrible things.
Yeah.
that, there's this lack of true understanding about how to support women as they get older. So I think we use the term multifactorial. I think there are a lot of different things that contribute, but, society's perceptions of aging, men can get old and wrinkly, but God forbid women do. I know we were talking about this before we started recording, but on social media, it's not at all unusual for people to slide into my DMs, and they can't criticize me about a whole heck of a lot, but they do like to, they're like, well, what are you, like 70? And of course, I'm not close to 70, but if that's the only thing that you can kind of like crack on me about is, perceived age or perceived, being north of 40 years old, then, that's speaking more to someone's own, mindset limitations and a really poor understanding of the way that, there's so many advantages to not being 25. I wouldn't want to go back to 25 if you gave me $1 million. So I think,
Agree.
I think all of those things certainly contribute, but the greatest contributor, I think, is just this disharmony, disunity, the influence of mainstream news, which, I mean, really, unfortunately, like my first degree was I was a poli-sci major. I loved having vigorous debates. We had lots of debates. I went to a university that was outside of Washington, D.C. And so we had a lot of vigorous debates. And then when we agreed to disagree, when we were done with class, we'd go out and like have a beer. And unfortunately now everything is so polarized and dogmatic that I think that is definitely not helping the situation at all.
Agree 100% on that. Okay, so I'm going to use an example of something that happened to me. When I was pregnant with my first baby, we decided to use my OBGYN and just continue with him. And when we got to talking about birth plans and getting more serious into that, and I specifically said, I really don't want an episiotomy and I don't want an IV. I mean, of course, if it's necessary, yes,
right.
But I don't want that standard, because back then it was just standard. You just did it. You just ripped whatever. And he said, no, that's just what I do. And I said, I really don't want that. That's, and he goes, fine, rip wide open like that. And I was like, oh, and yeah, in my 7th month, I switched doctors.
Good for you.
I hear that this happens a lot. And I just saw somebody on Instagram, and I love her. I won't call her out, but when she was dealing with issues with her baby, there were some pretty rough things that were said to her. And it's like, what in the world? It's like, it's almost like because you're a woman, it's easier to roll over you, because I guarantee you they wouldn't have said that same thing to my husband.
Right. And I, unfortunately, there is a degree of sexism, even if you're in medicine or you're trying to buy a car. We're in a rental house. I'll give you an example. And the guy that owns the rental house is very nice, but I let my husband be the person to deal with him, because, I'm like, if you have to be the heavy, then I'll let you be the heavy, because if I do it, it's not going to be perceived the same way. Same thing with, we're building a house and he is the point of contact for the builder, because it's in the South. And, sometimes in the South, women are kind of not thought of as equals. And I'm making a huge overgeneralization, but it's just come to find, like, this part of the state we're moving into, that is definitely the vibe I'm getting already. And so I'm just like, I'm going to let my husband deal with this. We've already talked about it, so he knows like what we want as a couple. And I'm like, you can deal with the builder. And so we're finding that is much more efficacious than me trying to have that conversation. But I agree with you. There's some degree of sexism that goes on. It's unfortunate. I'm the only female in my house, including our menagerie of animals and my children. And so I remind them all the time that, I'm like, listen, we have to be cognizant of the fact that things are not always equal for men or for women. It's not just specific to one gender, but yeah, in a medical setting, I've certainly experienced that. I think that I was able to navigate around that a great deal just because of my background. But I certainly saw examples of that, very arrogant physicians, oftentimes physicians. And I'm very pro physician. Let me be clear about that. I have a lot of very good friends and family members who are doctors, but there's definitely people who don't like being challenged. And that's really what it comes down to. They don't like being challenged. They don't want to be told, this is my birth plan and this is what I'm advocating for. I need to be my own best advocate. And even in my situation, when I was, so sick, I was like, please don't take my colon. And because I had a woman, I'm fairly certain that she really paid attention and tuned into that, because that is what happened. I didn't lose my colon, but even for you, I'm so glad that you were able to have the kind of birth plan that you wanted and needed, because
And
for
it
each
was
one of
excellent.
us, that could look very different. And you meet people that had terrible birth experiences and they're either afraid to have a second pregnancy or they're afraid to ever have another vaginal delivery, or they've been so traumatized, they then have a distrust of the medical community, which is such a shame. But unfortunately, those things happen. And as an NP, and as a nurse, I mean, I got to see it all. I mean, just all of it. So you can imagine that trickle down of someone who's really arrogant and says something like that to you as a woman. That's a trickle down effect. But there's probably nurses that have, dealt with that unpleasant person and other patients. And some women just feel like, oh, because I'm a woman, the doctor knows best. I'm like, heck to the no. Yes, in some instances they do, but you need to advocate for yourself. You need to be able to say, I like this idea, or no, that scares the bejeebers out of me, and here's why. And they should be able to listen to that and process it.
Yes, yes. And like, I've got like more confidence because I've done a lot of research, and it's my body. It's my body. What's going on in me, I need to know. And so instead of just blindly accepting, I ask questions. Questions.
Which is great.
My husband's like,
power.
oh God, but I'm
No,
like,
but it's
well, I
great.
want to know. And
Yeah.
I had this dentist, and he's awesome. And he loves that I'm interested enough in my
Yeah.
own body that I ask questions. He even, like, when I had some stuff done because of the horrible eating disorders and crap, I had teeth issues, like the back
Okay.
ones. And so he was doing some work on that, and he would actually draw diagrams of exactly what was going to happen.
That's
And
great.
he just loves spending that time with me and answering questions. But there are a lot of doctors, like what you were saying, who don't like to be, quote, challenged, even though that's
Yeah.
not what you're doing. It's your
Right.
body, just like
Right.
you with your colon.
Yeah.
Excuse me, no, I want to keep that.
Yeah.
Hello.
Yeah.
So how do women take that power back? How can you help? What can you say to help them get over that hurdle, to feel okay about asking those questions, about not just blindly accepting what you're told?
I think you have to do your research. And by this, I don't mean you go to only one website and you only look at one opinion. I think part of being educated is to get an appreciation for all the sides and to be able to sit down and objectively look at the information and say, based on my research, I would really prefer to do X. And, there was never, I mean, I laugh because when I was a new nurse practitioner, so I'm just out of graduate school, it's my first job, I'm terrified. God, for the first 6 months, I would go to work and I was like, please don't let me kill anyone, because you have so much responsibility as a clinician. And I'm such a conscientious person. And I'll never forget one of the first patients I took care of. And he would come in and he would have all this supplement data. And this is back when I wasn't as open-minded, but I was always very open-minded to what my patients would share. So then he would give me stuff to go home and learn about. And I would always say to him, like, even if I don't agree with what you're saying, I so appreciate and value that you took the time to research alternative perspectives. So I would say, first and foremost, the education piece, take time to educate yourself. Number two, speak with authority. Like, no one wants to hear you go, well, no, I want to do X, like a declarative statement, make it clear, or just even say, I would prefer to better understand this option. Okay. No one's going to denigrate you over that, but go in there with the information, your own research, be objective, be open-minded. And generally speaking, I find that most clinicians are very open to that they are, it could be in a situation outside the medical community, but I think, meeting people where they are is part of being a clinician. And I found most of the physicians and nurses and nurse practitioners that were in my age range, all were very open-minded. I think sometimes that kind of scarcity mindset thinking that you'll see in some healthcare providers, it could be generational, it could be a geographical, it could be an academic medical center versus a community medical center. And there's pros and cons to both. I always call it ivory tower, people that are just in academics and they're no longer, or they have a very hands-off approach to clinical, direct patient care. And they kind of forget that, that research study may say this is best, but is that realistic for your patient? And so I think a part of it is just, having declarative statements, and a lot of it's your delivery. And I think that's absolutely critical, because you can say just about anything as long as you say it nicely. And I've just kind of lived my life that way. Like when I had to say to patients, we really need to work on your weight. So let's talk about 5 pounds. Like, let's set a goal for 5 pounds. That sounds benign. And then I walk out and the physicians were like, that person needs to lose 50 pounds. I was like, I understand that. But if I walk in there and say, you need to lose 50 pounds, do you think that patient's going to be open to that? No, it sounds insurmountable. Let's start small. And
overwhelming.
So, right. And that's unfortunately the lifestyle piece is so critical, but I could say just about anything to a patient. It's all in the way you deliver it. And the same way it goes with communication with your healthcare provider, really just being respectful and coming from help me understand better, or help me understand my options better. I think coming into it with a curiosity, being very clear about your intentions. Unfortunately, now I think a lot of clinicians sometimes get frustrated because, if they get questioned all the time, they can just get frustrated. And I get that, but I don't necessarily think alternative approaches are a bad thing. I think each one of us has to, find the path that works best. I'll be honest with you. Like, people were shocked I left the hospital without having my appendix removed. My surgeon and I both agreed that I was not healthy enough to do surgery. It would be another stressor. So we waited 6 weeks. Then I had my appendix out. And she said to me, listen, your body had nicely walled this appendix off, but the issue is eventually it would have been a problem again. And I just said, I'm not willing to let it be a problem again. I can't ever go through this again. I think I have PTSD from being in the hospital and being so sick. So even as a clinician, I would recommend people really be clear about what your wants and needs are. And that is super important, irrespective of what area of your life you're doing advocacy for or on.
Absolutely. It's your body. It's your body. You're the one that's going to have to live with whatever decision is made. So if you come across somebody who is not willing to listen to you, what should you do?
The honest answer is people have to come to lifestyle changes and health changes on their own course. You can continue giving them information, but there's no point in forcing anyone to do anything. There's this trans-theoretical model of change. It's Prochaska and DiClemente, and it talks about how people kind of progress potentially through a series of mindset shifts before they are ready to make changes. Some people never get beyond pre-contemplation. They can be ready to pay money for a program. They can be ready to commit to being a part of a gym, but they're not ready to do the work. And that's one thing I've really learned being a small business owner, that I've had a lot of people pay me money over the years that really weren't ready to do the work. And it's important that we're honest with ourselves and honest with where we invest our time and our money, so that, it's very aligned, because when it's not aligned, it doesn't work. But it's beautiful when it is aligned and when it does work, when someone's really ready to make those changes. It is beautiful to watch. And I think, and I know it all starts with the nutrition piece, that so much of our health and wellness really starts from the foods we choose to eat or avoid. And if more people understood that, there would be less metabolic inflexibility, there would be less obesity, there would be a lot less health problems here in the United States, which is really kind of sad for me to see how much that's changed over the last 20 plus years.
Oh, yeah. Now that my eyes are so open, it's so painful, because you're like, oh, your life could be so much better. Yes, it takes some work, but once you do that work, your life is so much easier. And maybe you can get off that medication. Maybe you don't have to go to see the doctor every week or whatever it is, and it's so worth it. And it makes losing weight easier. It makes maintaining the weight loss easier. And it's so hard to get that across to people sometimes, it's sad. Okay. So before we move on, if somebody comes across a health professional that is absolutely unwilling to work with you, it is this way, period. You will have the episiotomy, whether you want it or not.
Right.
What do you do?
Change your healthcare provider without question. And it comes down to, is this person meeting your needs? Because you're probably not a good fit for them either, to be honest. And unfortunately, it's like trying to put a square peg in a round hole. Part of my job as an NP in this very big cardiology group was deciding, based on this patient's personality, who are they going to do best with? Because there are some docs who are going to completely tune them out. There are others who will be super receptive and will take the time to understand where they're coming from. And then there are some that'll just be meh. And then, and that was really a role I took very seriously, determining, who was best suited to see this patient. Now, most practices don't necessarily have that service, but that was a lot of, what the NPs did. We were like, oh, we definitely need to send this patient to Dr. So-and-so, because that person will take the time to listen to them. Whereas this physician, who's just as good of a physician, has no time for people questioning anything. They're an excellent physician. If I was having a massive heart attack, that would be the person to do my cath. But they're not patient enough like this other physician, and therefore, they're better suited. So absolutely, finding a provider that's better aligned with you.
Yeah, and it's so hard, especially in today's time, to have a doctor that actually has the time. It's not because they don't want to, or they're, not a great doctor, but they really honestly don't have the time, because they have to go by certain, you only get so many minutes per patient. You got to go. Yeah. And it's sad. And you have to have so many patients, because it's, becomes this business because of, yes.
And it's terrible. I mean, I can tell you that, hospital follow-ups, complicated cardiology follow-ups, I got 30 minutes, and normally I got 15 minutes. And I remember the whole time I was in that room, it was, okay, I got to make sure I get through these 5 things before my 30 minutes is over. Or patients who think that running 5 or 10 minutes behind is because, you'd have the first 3 patients would show up late, and then it would throw off your whole day. And then people would complain. And I'm like, listen, I ran my rooms and my books really tight, so I didn't keep people waiting. But, if there's an emergency, everything stops. And I think it's hard for people to understand it. It's almost like everyone's frustrated. Healthcare providers are frustrated because reimbursement is down and very poor, unless you're doing a cash business or you're in functional medicine and everything's fee for service. Or, patients are frustrated because they don't get enough time with their healthcare providers. They're paying more and more and more for health insurance, and they're getting less and less and less.
Yeah. Oh, yeah.
And so, case in point, that my husband and I, our insurance flipped in the beginning of the year. And so we're now part of this huge, we're in a huge bucket. So yes, we have insurance, but we have to spend, I don't know, $5,000 before we'll get any coverage. So every single time one of us sees a doctor, we get a bill that says, okay, well, your portion is this. And I said to my husband, I'm not sure which is better, having to pay $600 a month for insurance coverage, which is what we did before, or now we just pay every bill that comes through the door. And, it's an interesting transitional time. And unfortunately, it's a lot of the metabolically ill that are driving this incredible expenditure for healthcare costs. I mean, escalating rates of obesity, diabetes, metabolic disease, a lot of cancer and, vascular disease. And unfortunately, the people who are healthy are paying for the insurance for those that are not. And that's really what it comes down to. And it's not a criticism. It's just, that's exactly how things work. My insurance premiums continue to go up, even though, with the exception of having a healthcare hiccup, I've never been sick a day in my life. Same thing with my kids and my husband. We've all been very healthy. And so I think that, things have to change. They really have to change.
I agree, because we've kind of shifted from healthcare to sick care.
No,
there's a huge difference there. And I find that so incredibly sad. And even with what we're dealing with right now, what we're seeing, so much could be avoided by some simple, and it really is simple. It seems so awful, but it's really not that difficult. If I can do it, anybody can do it. And it would change things, and they wouldn't have to be so afraid of, catching something, because they will be able to trust their immune system. But what is it? 88% of us have like metabolic issues, something like that.
That's the latest statistics, and it's not going to get better. And, I
No.
interviewed I interviewed a physician earlier this year, and she believes strongly, and it makes sense to me, that the drive for seed oils, so canola oil, seed oils are canola oil, soybean oil, cottonseed, sunflower, safflower, etc., in the processed food industry has driven carbohydrate addiction, which has driven insulin resistance. And I was reading something Dr. Ben Bickman wrote the other day, and he said the most consumed fat in Americans' diets is soybean oil.
I saw that.
So, which is like just disgusting. And so I think about, and I always go back to, it all starts with food, and that drives, how well or diseased we are. And so if you do nothing else, I don't care if you decide to be plant-based, carnivore, keto, low carb, paleo, primal, etc., avoid seed oils and read food labels and just eat less processed crap. And if you do those couple of things, your health is going to be infinitely better than the person who eats a bunch of processed crap and eats a lot of seed oils and doesn't move their body and doesn't sleep, and doesn't manage their stress. And so, yes, you're right. There's a lot to unpack. But unfortunately, we've conditioned patients to believe that we need heart healthy grains and we need a lot of carbohydrates, and fat is bad and meat is bad and saturated fat is bad. And so, it's all this old dogma. I remember telling, it's like slather yourself in sunscreen. And I'm like, well, ever since I started being more meat based, I don't have to wear sunscreen. Why is that? And, now that I get outside, I walk my dogs a lot, and that's exercise for them and for me. And just exposure to sunlight will help you on so many levels. And yet we condition people to fear the sun and to fear fat. And it's this trickle down.
And meat.
Yeah.
Meat.
Yes. And yet, that's a satiety thing. If you eat a piece of steak, you are going to be much more satiated than you eat a bowl of pasta. And, when I look at my teenage boys who are very athletic and very fit, they can manage the insulin response they get when they eat a pound of pasta. Whereas if I were to eat that, it would mess up my blood sugar for days. And so not in a good way, because we're at a different life stage. And I don't have as much lean muscle mass as they do at their ages. So I think it's really important for people to understand, like, what's the science? What are behind these recommendations? I've had people tell me, you just want to, ruin my day because you're telling me not to eat bagels and ho-hos. And I'm like, seriously, do you actually feel good when you eat bagels and ho-hos? Because I feel, pardon me, like shit, crap. I feel like crap when I eat those kinds of foods. I don't feel good. Like, I can have a piece of dark chocolate every single day and I'm completely satiated and happy. But if you give me something that's gluten-free flour, it will mess up my blood sugar for days. It's a proven, like, my husband laughs because I wear a continuous glucose monitor, and I got mine. And, on Easter, I had a gluten-free brownie, and not a lot. And I think I had 2 cookies, which I never do. I think the last time I had any of that was probably Thanksgiving. And my continuous glucose monitor was messed up for 2 days, as was my lumen. And I was telling my husband, I was like, I just don't feel good. Like, when my blood sugar's, it's not even that high, but it's just, I don't feel good. So really being tuned into your body, I think is certainly very important.
It is incredibly important. And I will tell you, one of the experiments I did with my continuous glucose monitor was honey, because that's this big controversial thing in the carnivore community. Well, I used to eat honey seriously every day for lunch, mixed with peanut butter on my whole wheat, low calorie bread. And I decided to test the honey to see for myself what it did on my body. I mean, if some people can handle it, I don't have a problem with that, whatever. But to say that, it's a good thing just because it's kind of under carnivore, maybe not so. So I tested it. Ooh, that was the only thing that I've eaten. And I've experimented with a few things. Most things I just don't care enough about to even, there's no point, I don't care. But that was something specific. It went up above, the 140. It went boom like that. But that wasn't even the worst part of it. I felt dizzy, nauseous,
really,
and just like not right for like, I don't know, probably a good 2 hours. And I was like, no, that is not worth it to me. I felt bad. And so, no, that's just not okay.
Well, it's interesting. The only thing, there's been a couple things that have made my blood sugar go up. One was plantains, which I used to just eat plantains with coconut oil and sea salt, and that was fine. The other thing is I must have gotten some seed oils in a dressing when I was out. I was out having seafood with my husband. And I looked at my husband, I was like, oh my God, I hit like 160. That never happens. And so I called the restaurant and said, what was like, I'm almost afraid to ask. Like if you go to a restaurant, you can assume you're getting seed oils. It's going to happen.
Yeah. Yeah.
And so even though this was this high-end restaurant, they're like, oh yeah, it's like a canola oil, extra virgin olive oil blend. And I was like, okay, well, that's the end of that. But I think it's really, even with my patients, I have them check with like berries and sweet potato and beans and honey. And it's interesting to see so much of it's bio-individual, meaning everyone is so different that people will have a different glycemic response just with different carbohydrates. And I love how there's a lot of the carnivore keto dudes that like effortlessly eat honey. And I'm like, I'd love to know what your insulin and glucose response is, because
me too.
I've come to find, and I'm like, that's fine if people want to use honey. But when you look at the data, you're like, wow, that is really unbelievable. And so that's the one, big takeaway when people wear our CGM is just how valuable that information is.
Right? Is it not the best thing? And
I think everyone should have one.
I do too. But I see a lot of criticism like, well, if you're not diabetic, you're taking one away from a diabetic.
No.
Okay. No, actually, no, we're not.
I pay for
it. We pay for it. And it's not a medical prescription thing. Well, we go through a company that kind of takes care of that. And we work with a dietitian, which I think is awesome because they are trained to be able to deal with people like carnivores and keto people. So it's not just your standard American diet kind of dietitian. So I love that. And I have learned a lot about my body, and I thought I already knew a lot. So I absolutely agree with you 100%. And I especially think it would be good for women. I mean, I'm not saying it's not beneficial for men too, absolutely. But I think women have so many different, things going on, and to see how it reacts, even stress. I mean, you can see how stress reacts with it, and you can see how alcohol will react with it. And I've done some experiments like that. And really the only thing that has been bad as far as glucose goes is that honey.
It's amazing.
Everything else is I had a baked potato after I ate steak because that's just the way I would do it anyway. There's no point in, and it went up higher than my normal, just all meat, just a little, but it came right back down. And the dietitian, because I didn't really understand fully how to read them. And she was like, oh no, that's excellent. That tells me that you're pretty insulin sensitive. And I was like, Bajiga, because I was like so worried that I still had a lot of issues. I'm not saying I'm great, but much better than I was, because I was pre-diabetic, right there on the edge of being full-blown diabetic. So that made me feel really good. So I think CGMs are really, really an important tool. And anybody who poo-poos on that, well, I'm sorry, but it's great to know what's going on in my body.
Well, and I think it's interesting because women that have them through my direction, they're always like, oh my gosh, this is amazing. Like now I'm obsessed. And I'm like, yeah. And then after about 3 months, then you're like, okay, I need a break. That's kind of where I am. I think I have one more sensor, but it's been truly invaluable. And I think it's, as you said, it's really interesting to see the impact of sleep, stress, where women are in their cycle. So I always say to women that, usually the week before their menstrual cycle, the 5 to 7 days, don't be fasting. That's the time where you're a little more insulin sensitive. You can, increase your carbohydrate load. I just see it's fascinating. And then, women, unfortunately, when they hit menopause and even in perimenopause, they become more physiologically insulin resistant, and you can be doing all the right things. And then you get a CGM and you're like, whoa, what in the heck is that?
Yes, absolutely. And I'm kind of heading that way really quick. Okay. Do you have time to get into intermittent fasting really quick, or is that too? Okay.
Nope.
All right. Let's talk about, since you are considered to be an intermittent fasting expert, and that is like a really big thing in all the communities, really diet related communities at this point. Talk a little bit about that, and specifically how it pertains to women.
It's a great question. So intermittent fasting is really eating less often, which is very aligned with ancestral health patterns. We're not designed to eat 16 to 17 times a day, which is, one of the statistics I read, if you account for sugar sweetened
I can't even
beverages,
imagine that.
it's disgusting. It's totally disgusting. And so there's that. And then, most of the research that's been done on intermittent fasting has been done on lab animals, which last time I checked were not lab animals, men, and then obese menopausal women. So there's this whole subsect of the female population that is not really understood. There's some conjectures made. My general feeling about women and fasting, and I'm actually writing a book on this specifically, is that women that are 35 or under, so really in the prime of their fertility years, have to look at fasting differently than a woman who's in menopause, or even a woman that's in perimenopause, the 5 to 7 years preceding. Women that are still cycling, their bodies, even if you're not ready to have a child, your brain doesn't feel that way. Your brain is thinking, I am very sensitive to macros, whether you're eating them or not. I'm very sensitive to stress. I'm very sensitive to sleep. I'm very sensitive to overexercising, and it will adjust accordingly. So sometimes the best thing for women that are still fertile, and really, let's be honest, our eggs are as old as we are. So 35, I'm not, yes, I know women can get pregnant beyond that, but let's just kind of focus on our ovaries are as old as we are. So our eggs are old by 35. And, our fertility does start to kind of trend down. Those are the women that I sometimes will say, maybe it's better for you to fast every other day, or, be really cognizant the 5 to 7 days preceding a fast, not to fast. Then you have perimenopause, which is this nebulous time when people really start to, pardon me, mess up their hormones because they overexercise, they don't sleep properly, they eat highly inflammatory foods, they don't manage their stress, which just makes that all worse. We become much more physiologically insulin resistant. We have a drop off in progesterone as, most months we're no longer ovulating, in perimenopause. We get crime scene periods with these very heavy periods, almost to the point where everyone thinks they need hormones, they need an ablation, or they need a hysterectomy, because that's what traditional allopathic medicine will recommend. And so what I oftentimes will say to people is you have to really start sleeping better. You have to manage your stress. You have to stop doing CrossFit 5 days a week and thinking that's not tanking your adrenals, which are trying to pick up the slack for the drop in progesterone from your ovaries. And so some of these women can fast every day and some of them cannot. It's a little bit of trial and error. And again, the same thing, 5 to 7 days preceding your period, no fasting. And then menopause. I think menopause is when women are in their groove, meaning there is less net concern for cycling hormones because they're no longer cycling. This is 12 months without a menstrual cycle. They're more akin to men in that their hormone levels tend to be a little more stable. So that's the perfect time for women to fast. And so I've come to find, provided that they're sleeping through the night, they're not over exercising, because we've conditioned people to believe that in order to lose weight, you have to exercise harder, not smarter. You have to eat less food, not more strategic intake of food, that stress is irrelevant, that sleep quality is irrelevant. And I tell people, I'm like, if your energy is terrible and you can't sleep through the night, do not add in intermittent fasting. Do not, if you cannot sleep through the night, that is another hormetic stressor adding to the body. It's kind of like this balancing act that you're trying to do. And yes, men have a much easier time with fasting than women do. And a lot of it's our hormones. And some of it, there's a researcher, Stacy Sims, who talks about how a woman's menstrual cycle is an ergogenic aid, meaning it's something that can be advantageous, but we have to use our hormones to our advantage. And so throughout the menstrual cycle, there are definitely days to eat certain types of foods and do certain types of exercise, and definitely times during a woman's cycle where we should not be fasting. Not enough people talk about that. And then, the other piece of it is, we look at vital signs, blood pressure, pulse, temperature, et cetera. And I look at the menstrual cycle as another form of vital sign. So if someone starts intermittent fasting and their periods are a little wonky for a few months, that's okay. But if you start fasting, you're not pregnant and your period goes away, it's too much stress. And not enough people talk about this. And then women are so confused. They don't know what's going on. They don't know what to do. And that's oftentimes where they'll sometimes end up in either in a group of mine, or they listen to a podcast, or they end up in a, social media group, interacting with me. And I'm like, well, these are the things I generally recommend. And you kind of go from there.
I think that is so incredibly important. And that's kind of what I tell my clients too, female clients, when they're like, oh, what about intermittent fasting? I'm like, well, let's talk about this just a little bit.
Yeah.
I'm an advocate for it. I'm an
Mhm.
intermittent fasting coach. I'm not that much of an expert,
Mhm.
but I know enough. But,
Mhm.
you know, there is some question there. And I see a lot of pushback on that when you do kind of speak about it differently, you know,
Mhm.
like, well, maybe at this particular time, you're not saying it's bad or you should never do it,
Right.
but just in this circumstances, oh, well, intermittent fasting is good for everybody all the time, you know, that kind of
No.
thing. And I'm like,
Yeah, there's no
but if your
blanket
body's
statement.
stressed and
Yeah.
you already
No.
have so much inflammation, then just add
Yeah.
some more stuff on there, you know.
It's like adding
So
gasoline to a fire. I mean, that's really the way to think
yeah,
about it. So when
yeah.
women, I mean, I can't tell you how many DMs today with people that are stuck. And I'm like, well, I've got a master class coming up, or I've got a podcast on that. I think that there's just not enough research, and there are not enough people that really are kind of allowing women to explore how that looks. Like, I don't recommend intermittent fasting if you're pregnant. I don't recommend it if you're breastfeeding. If you're trying to conceive, some very specific circumstances, if someone has PCOS and they're 100 pounds overweight, fasting and low carb may help them lose weight, and then they more easily get pregnant. But generally speaking, there are definitely some specific times that I suggest people not fast. And, you know, there are all these fit pros on like Instagram, and I sometimes will call them out. I'm like, you know, you're not doing women any benefit by walking around in your teeny tiny bikini, and this is your fourth kid, and you've got like all the help in the world, and you make it look like you're doing all this effortlessly. Well, you've got an eating disorder, and you actually hide your eating disorder in intermittent fasting. Like, that's really the issue that's there. So I think you just have to be careful. And, you know, if you're trying intermittent fasting, just dip your toe in the pond. It doesn't work for everybody. In fact, there was a message from my team asking me to look at an email that they got from someone who's trying to force intermittent fasting. And I'm like, I just don't think it's working for you. And that's okay. That
But
is
I think when you
totally
have to
okay.
force it, that's your key right there too. If
Mhm.
it's so hard to be able, and you're making it because you're told, oh, this is what you're supposed to do,
Mhm.
that's kind of a red flag for me personally.
Exactly.
Because
Exactly.
when I fast, it's not difficult. It's
Right.
easy for me.
Yeah.
But I'm very
Totally.
fat adapted, and
Mhm.
you know, I also understand I shouldn't do it when I'm seriously stressed, and I am right now, and I can't seem to get my cortisol down. I don't know what the deal is with that, but
Have
I'm
you tried any
trying.
have you tried any adaptogens?
No, no.
My
Ooh, we'll
favorite to
talk.
put in my water is lemon balm.
Lemon balm. Okay.
That's
Where do you
ex
get that, or what is that?
Yeah, so it's an adaptogenic herb, and so I use a tincture, and so when I'm feeling, like, revved up, it's one of my favorites. Message me
Mm.
afterwards, and I'll show you where
Yes,
I buy it from.
absolutely.
Yeah, I like adaptogenic herbs because they're naturally occurring substances, and so I always say, like, I'm an NP, but I'm not anyone who's listening's NP, but I personally like specific things, like when I'm feeling revved up and stressed, adaptogens like lemon balm, ashwagandha, rhodiola, or the calming,
Ashwagandha. Mm,
yeah, or calming, you know, adaptogenic herbs.
yeah.
You know, really making sure you're balancing your stress, like getting out in nature. Like, I took my dogs for a
Mm.
mile walk at lunchtime, and yes, it was a little warm here in Washington, D.C., but good for me to I got out without sunglasses on. I get sunlight exposure. The dogs come home and they're tired and they're worn out. Like, I'm laughing. I've got both of them at my feet because it's so hot. They're worn out. Exactly. They're really worn out. But yeah, all those things can be very helpful and balancing. So when my
All
cortisol
right.
slash glucose is up, usually because of stress, I'm like, I put myself to bed earlier. I don't do as much strenuous exercise, which for me as a type A sometimes can be a little challenging. Like, I didn't go to the gym yesterday or today because I didn't sleep really well. And so I woke up this morning, my blood sugar was a little higher than it is normally, which I know is related to the stress response. So I was like, okay, walking today. That's what we're doing. Walking today. So
Awesome. Okay, just really quick, can
mhm,
you go through like what some things that a woman can do when they're in the category of perimenopausal
mhm.
and the difference with menopause? You can just be really brief, but
Yeah.
I'm just kind of curious about that breakdown, because since I'm kind of entering that time of my life,
Mhm.
and I have so many people coming to me asking those questions.
Yeah, no, for some reason, this has kind of been the space I fell into when I left clinical medicine. So, number one, you've got to get high quality sleep. So, 7, 8 hours a night of sleep, cold, dark room. The colder, the better. Like that is absolutely important. And, having a sleep hygiene. So it may be that you get off electronics, you wear blue blockers, maybe you take some magnesium, you soak your feet, etc. Number two, you got to manage your stress. And this is not just, I'm going to go read a book and chill. No, this means meditation, connecting with nature, grounding work, gratitude journaling, yoga. This is gearing yourself down. You're getting out of that fight or flight and kind of tapping into that parasympathetic rest and repose. Number three, most women, I hate to say this is not going to be popular. Inflammatory foods. I'm talking about alcohol. I'm talking about dairy. I'm talking about gluten. Perimenopause, ladies, you are more prone to having more leaky gut issues just related to the stress response. And so I tell people, I'm like, kick some of those things out of your diet if you're not seeing results. Number four, absolutely positively eat less often, without question. I don't care if you fast or not, but you should not be eating mini meals and snacks and eating and drinking, a couple glasses of wine every night. You are undoing a lot of things. And the one thing about alcohol that I want to mention is that with alcohol, you dysregulate your blood sugar, you increase cortisol and suppress melatonin. So it's going to make it harder for you to go to bed. And that's oftentimes the only time women will get sweats. And there's nothing fun about night sweats for anyone who's ever had them. I would say lastly, making sure that your exercise is not harder, but smarter. I used to do CrossFit and a lot of these really, really tough, hardcore conditioning classes. I was so depleted and I was very fit. I am very fit. But now I worry about strength training. I want to make sure I maintain lean muscle because muscle is a reservoir for glucose, really critically important. Couple days a week of strength training, 1 or 2 days a week of HIIT, get out in nature, walk as much as possible. Everyone should be aiming for 10,000 steps a day. And those things really don't change heading into menopause. It's like perimenopause is that time in our lives where our bodies will tell us, you've got it all together or you don't. And now's the time to get it all together so that you will make that transition easier. The people that make the effortless transition from perimenopause to menopause do exactly the things I talked about.
Awesome. So, but with menopause, you said that you can probably deal with intermittent fasting a little more than
a little more regularly.
So that's probably really the only big difference there.
And there's certainly people in perimenopause that do well with it, but it requires some experimentation and really being cognizant of the week preceding your period, not fasting. And that for a lot of people, if they're very type A, they get very flummox, what is going on? And so I have to remind them that I'm it'll be okay. This is really beneficial.
So what are the symptoms of overdoing the intermittent fasting? What can somebody, if they're really not all that aware, what can you look for?
The big things for me are sleep. If you suddenly don't sleep well, your sleep is crappy. Number two is energy. Number three are menstrual irregularities. I mean, those things shouldn't be happening if you're doing it right. And those are kind of three big categories. But I always say, if you can't sleep through the night, don't fast. If you can sleep through the night and you start having problems, that's a separate issue. But I think if you focus on those three areas, you definitely will do well.
Very good. Okay, well, thank you so much for all that information.
You're
but now
welcome.
give us a little bit more information on you. Tell us what kind of services you provide. And I know you have a workshop coming up, and I am seriously thinking about joining that too. I can always learn more. And also your book a little bit, and where can people find you?
Yeah, thank you. So IF 45 is a 45-day journey into intermittent fasting with lots of challenges. There's prep week. It's a really great community, predominantly of women, but definitely designed to be able to support women, whether they're cycling, perimenopausal or menopausal. I'm no longer doing one-on-one work. I have a team member who's another advanced practice nurse her name is Tessa. She's wonderful, but I run group programs. I have an amazing podcast called Everyday Wellness, where I get to connect with some incredible health and wellness experts, and that's on iTunes. And then I'm all over social media. I'm on Instagram and Twitter. I've got a private Facebook group that's free. It's Intermittent Fasting Lifestyle / my name. And then, yes, I'm writing a book on intermittent fasting for women. And that is hopefully going to come out with Penguin Random House in early 2022. So I'm about halfway through the book. The manuscript is due in May. And so if you don't see me on social media a lot, it's my team is stepping up my game while I spend a lot of time writing.
Awesome. Thank you.
You're
And hey, y'all,
welcome.
go ahead and subscribe to my channel while you're here, and then go follow Cynthia. I'll have all her stuff below, so don't worry. And even the links to her TED Talks, because I've seen bits of at least one of them that is very amazing. So y'all need to do that. And again, thank you so much, Cynthia.
Thank you. Have a great day.
You too. Bye.